over the years why people are not getting colonoscopies.
So it's not necessarily the myth, it's the stigma associated with it. So sometimes people don't want anything back there, for a lack of a better term. And also, a lot of people are worried about the prep. And what I like to remind patients is that it's one day and potentially 10 years that can make a lifetime of difference. So, yes, prep is not the most palatable sometimes, not the most fun to do, but it's only one day and it can save your life.
It can save your life for sure. Doctor, let's talk about some of the wake up and watch signs that a lot of people need to kind of keep an eye out for. What are some of the symptoms? What do we need to be very careful about?
And that's what I want to caution a lot of people about. A lot of times, if we see those signs and symptoms of colon and rectal cancer, it's usually coming at a later stage. So some of those signs include abdominal pain, fatigue, night sweats, bleeding, whether it be dark stool or a bright red stool. All of those signs are usually seen in later stages of colon and rectal cancer. So that's why we often recommend getting your colonoscopy starting at age 45 for all average risk patients, because we want to catch it early. Colorectal cancer is preventable and it's treatable, and we can beat it.
And doctor, very quickly here, who is at greater risk? Younger people, older people, black, white? Who are we talking about?
So we are seeing it, as I said again, in more young people, and that's why our screening age has dropped to 45. We also see disparities in the amount of, especially Memphis being a predominantly or majority black, the largest majority black city in the country. We would be remiss without mentioning that African Americans are diagnosed at 20% higher than our white counterparts, and we die from colon and rectal cancer at 40% higher than our counterparts. So it's important that all people, because it is the third largest leading cause of death in the world, so we want to make sure that we take care of our colon and gut health.
And one last thing, can it be passed down maybe from one generation to another? Maybe if your dad had it, could I possibly get it? How does that work?
Absolutely. There are, while it's not the most common way of spread, meaning it's usually sporadic, there are familial linkages. And that's why if you have a first degree relative or multiple relatives with colon cancer, we deem you a higher risk. And so your screening age, if you have high risk family members, you would drop down from every 10 years to getting your colonoscopy to every 5 years.
Right.
And if your family member has had cancer, it'll be 10 years sooner than their diagnosed age.
All right, Dr. Paul Johnson, thank you very much for taking the time to be with us today. We do appreciate it.
Thank you.